Jackson, video number 8, barrier nursing, and here we are in front of the ISO ward at Green Cross Vets in Sandringham, just to show you the isolation ward, how it's marked. It's marked with this yellow and black. You can see here, you can see that it's got the actual type of patient written on here, it's got who he is, and also it's got the level of PPE that you need. We need to demarcate this area because it's a high risk area. It's an area with potential zoonotic diseases which are harmful to people as well as other animals, and it's highly contagious, so people have to know that they have to put on a specific type of PPE. Sarah Jackson, video number 8, barrier nursing, just talking about PPE. Why do we wear it? Why do we wear it in the isolation ward? We wear it essentially so that we do not cross-contaminate when we come out of the ward. We do not wear it, we dispose of it essentially so that we do not cross-contaminate other patients, other staff, other clients with the pathogens that we have been exposed to and cross-contaminated with in the isolation ward. I'm just going to put on my PPE now in the order. So I've got my gown. Like this. Top necktie and the middle tie. That I do into a bow. It's easier to cut off afterwards. Surgical point covering your hair. And my ears, covering my face. Tight and fit well. And pulled right under. I'm not going to slip off or dangle off. And pull those right down. Sarah Jackson, video number 8, barrier nursing. I'm now making up my foot bath before I go into the ISO ward. I'm going to use disinfectant Trigene 2 and water at the high rapid risk rate of 1 to 20. Essentially, I'm going to take 1,000 mils, make up the whole amount up to 1,000 mils. So that means my calculation is that I have 50 mils of Trigene to 950 mils of water. So just to show you, this is, if you can see, it's a bit wobbly, but that is at 950. I'm going to put that into the kitty litter tray. I've already got 30 of the 50 measured out here. So I'm going to put that into water. I'm also now going to take a further 20 mils up to the red line, there. And if you can see, put that in. Sarah Jackson, video number 8, barrier nursing, Green Cross Vets. So I've just set up the foot bath and now I'm going to go through it and just to talk to you about precautions we take when we're handling potential zoonotic patients. We use everything is minimal. So minimal time spent in the ISO ward, minimal time handling, so a minimal technique, so not cuddling too close, not making too much contact as much as possible. It's not time for perfection, it's time to get the job done and to do it safely and adequately. So just to show you quickly, I've got Trigene and the water mixed at the 120 rate, which is the 50 mils of Trigene plus 950 mils of water. I've got 2 towels. I step into the bath. I would make contact time for 5 minutes, but for the video's sake, I now dry my feet. I've got my foot covers, my 2 here. I'll put these on down there, put these on. So now anything that was on my shoes has been disinfected and cannot cross-contaminate into the ISO ward. Obviously getting through the door, I'm going to be, you can see that on there. Going into the ward, I'm going to open the door very swiftly. And I'm going to put the fan on for negative air quality, negative pressure. Sarah Jackson, video number 8, barrier nursing at Green Cross Vet Sandringham with Charlie Wilson, patient parvovirus suspected in the ISO ward. So we're just going to do his respiratory rate at a distance. At the moment I've also been checking out that he's okay, there's no diarrhea, and that how he is in his demeanour. He is a bit flat, but he is fairly bright and perky with his ears forward. So just in terms of, I've got a nurse watch here which will get sprayed later. So I'm looking at Charlie from the side. I'm looking at him, and I'm looking and I'm counting within 15 seconds on my watch. So 8 breaths within 15 seconds is 32. So that's within range. Just going to put you on here while I go and get him to do his pulse rate. Good boy. Good boy. Just going to pick him up minimally. I'm holding him away from me. I'm not holding him into my chest. So he's being carried like this, and under his bottom. He's being put onto the table. One hand on him. Obviously there would be another nurse usually hold him. So put a little slip lead on him as well. Just so I've got greater control there. Let's do his pulse rate. So underneath his left side. I think you can see that there. Okay. Counting in tens. And 30. So that's 30 within 15 seconds, so that's 120 as his pulse rate. I'm just going to do his temperature now. You see I'm simulating this with Charlie, and I'm just going to put a bit of lube on there, and like that. Switched it on. I'm angling that in. So it's going in. Let's simulate that it's gone into Charlie. You can see there. Okay, great. And that is 38. I'm just going to wipe this with some tissue that I've got here. Like this. I will record all of these outside on the chart afterwards. So Jackson, video number 8, barrier nursing, Green Cross Vet Sandringham. Just been cleaning my temperature, my thermometer, and I'm just going to put that back in. I've disposed of the paper. I'm going to put the paper into the clinical, you can see the clinical waste bag there, and the thermometer, which I will get into cleaning later. It's gone into a sterile kidney dish. And so just to check as well, I'm just going to check one thing I forgot earlier, which was his mucous membranes, looking they're nice and pink. I'm just going to blanch them to check the CRT and check that that does blanch back and come back to pink in 2 seconds, and that's under 2 seconds. It's also quite moist as well. He's looking okay. And now I'm going to transport him safely back with Charlie into the cage, away from me. There would be a nurse obviously to assist me opening the door. And then just take Charlie's slip lead off. Quickly out the door. Video number 8, barrier nursing, Sarah Jackson, Green Cross Vet. Just to show you, I've written up here with a pen that I will disinfect the respiratory rate, the pulse rate, the temperature. I also know off my head that it's mucous membrane and his capillary refilling time were pink and under 2 seconds. So just to show you, I'm going to take one layer, holding that inside like that. Gloves before I start cleaning, so that's got rid of one of the most major ways of contamination, root contamination. So just to show you, I'm going to get rid of any other disposable items. So let's say we use swabs in the treatment, they're going into clinical waste. This is a towel, this is going to have to go into clinical waste. So get rid of all of that. Now we're going to sterilise and clean our disposable, non-disposable items. That's another swab, so in you go. So, we've got a tap here, we've got warm water and detergent, then we've got, let's clean Make sure that the pen's okay. Make sure there's no organic matter. Get that all off. Make sure there's nothing, no blobs of anything, no saliva or bodily fluids or anything, or diarrhea from his pores. It's gone onto here. Chuck it. Gone. Now, I'm going to spray this hygiene. Oh, actually, let's just also you pretend that this has got hot water on and detergent, and this is being cleaned. So we have this clean stethoscope. We also clean our lead as well. Now we're going to spray the items with our Tridene 2, which is already made up. This is our ISO. This is made up to 120, 1.20, which is a rapid high risk rate. So we give that a little spray. This is a little spray. The leader spray and hang that for a minute. So they're going to actually pretend that these are going to be, let's say, 5 minutes. I'm just going to do my door handles as well over there. Okay, so then once we have made sure that the Tridene has had 5 minutes of contact time, then we're going to get rid of it using disposable paper. Get each item laid out again. Doing the lead, doing the thermometer. Dispose that into clinical waste. And now we're going to do my PPE. Sarah Jackson, video 8, Barrier Nursing. Now we're going to take off my my PPE as per the ABA guidelines for veterinary biosecurity, personal biosecurity. I don't want to spread any pathogens back into the clinic, back across from this area into that area. The staff, I don't want to affect the staff, I don't want to infect the clients, I don't want to affect other animals and other clients. So essentially my gloves, my second layer, I'm going to take off like that. And I'm going to slide my finger up into there, and then inside out. They're going into clinical waste. Just to drop them like that. So I think of this as GPGSM. So gloves, protective eyewear, gown, shoes, mask. So we've done that. We're going to do our protective eyewear. I'll take this off. I'm also going to give this a spray of Tridene and leave that on there as well, just to have contact time. So that's GP, and then it is the GPG is the gown, protective eyewear. That's gown time. So gown, then shoes. So untie the ties, and you take it from the inside out. So I'm going to turn this inside out. I'm actually unfastening here, and off it comes. And this is going to go inside out, just touching the inside of the gown. That goes into the waist, like that. And now we've got our shoe covers. And also double up with the surgical bouffant. And lastly my mask, which I will take off like this. It's going to be disposed into the clinical waste, because it is clinical waste. It has to go to a specialist company who's going to incinerate it, and it's not going to go into the general waste, not to infect landfill and the environment. Now Sarah Jackson, Barrier Nursing video number 8, and just to show now, I'm going to get hold of my clinical waste, and I'm going to make sure that it is tied nicely and shut, so I can't drop any between here and the bin. And when it's inside of the clinical waste bin, it also will not fall out. And I've just sealed that up with some tape, so that's nice and tight. I'm just going to take you out to the bin. Okay, so let's go here. I'll go out to the bin outside, which is out the back door of the ward, which is direct to here, which is clinical waste. And if you can see, this is a dedicated bin. So we drop that in. That has its own bag, so that goes in the bin. And that is, seal that. Just sealing the bag. Close the lid. Make sure that's on. And I come to the back door. I might have something on me from the bin liner. So I take some F10 hand sanitizer, some gel. I rub my hands because we don't have a sink out the back here. Okay, let's go in. So I've now got no PPE. I'm going through, and last but not least, let's go to the foot bath. Sarah Jackson, video number 8, Barry Nursing. We're out the ward just to show you on here. I've written down the details. 38 is the temperature, 120 for the heart rate, 32 for the respiratory rate, pink moist, and under 2 seconds in initialed. Now I'm going to go through the foot bath. So you can see my feet are in there. I'm doing it very quickly because we don't have much time in the video. So I'm just dried my feet so I don't have to create a slip hazard. I'm just going to wet my hands, take my rings off. So my rings are off. This is well-organisation hand washing technique. So I'm just going to wash my hands over here. Nice and moist, taking time. We'll heat up a bit of iodine scrub soap. So start by washing hands like a sink, like that. We're going straight up, and we're going to go in between and straight up. Then we go at an angle to get in between, like that. Then we're going, oh, didn't do that one there. We rub them around like that. Then you do that where you rub almost like the nails into the palms, and like a twist like that. And finally each thumb, like this, twist, get all the way around the thumb. Then you rinse off again. And I grab some paper and I pat my hands dry. So we'll then dispose of into the liquid. And for hand care, we've got some vitamin E hand cream. I just put that on there to create a barrier on my hands so I don't have cracks, and I don't get infection into the cracks of my skin.